Good afternoon, everyone. It's such a pleasure that you could join us today, and I want to welcome you to our new webinar series, Beyond Our Walls. This is the first webinar in a three-part series that's going to be exploring the impact the Princess Margaret is having around the world with our global cancer program. Now, my name is Miyo Yamashita. I'm the new president and CEO at the Princess Margaret Cancer Foundation, and I want to thank you for your time. Thank you so much for joining us today. As a webinar registrant today, this is your time with us and with some of the top scientific and clinical minds globally in cancer control right here at the Princess Margaret in Toronto. And so since this is your time, I really encourage you to ask your questions and send in your feedback. You can submit questions throughout the session using Slido, and the link can be found in the session description below. Now, on to today's webinar. Despite decreases in cancer death rates in high-resource countries like Canada or the US, we know the number of cancer cases is actually projected to more than double worldwide over the next 20 to 30 years. And by 2030, it's projected that there will be 26 million new cancer cases annually and up to 17 million cancer deaths per year. In the US alone, by 2030, the CDC is estimating that cancer will overtake heart disease as the leading cause of death, killing at least 640,000 people in the US every year. But we know that the greatest burden of cancer is actually going to be experienced in low and middle income countries. So what can we do? Well, the Global Cancer Program here at the Princess Margaret is actually the first of its kind in Canada, and is one of the top 5 cancer centers in the world. We are uniquely positioned at the Princess Margaret to address the growing disparities in cancer treatment within our communities and internationally. So today we're going to hear from 2 of our leading radiation oncologists and 3 international fellows on 3 topics. 1, how the Princess Margaret is driving discovery in global cancer control. 2, how the Princess Margaret is accelerating global cancer control through key partnerships. And finally, 3, why this incredible science is happening right here. And you'll learn about what attracts the top minds in global cancer control to the Princess Margaret and how we can accelerate our impact together for the benefit of Canada and the entire world. Now, let me introduce you to these 2 great radiation oncologists that I mentioned. First, Dr. Danielle Rodin is the program director of the Global Cancer Program, radiation oncologist, as I mentioned, at the Princess Margaret Cancer Center. She's also an elected member of the board of directors for the Union for International Cancer Control in Geneva, and she holds a Harkness Fellow from 2017-2018, which I liken to the Rhodes Scholars of Cancer. Danielle's clinical interests are in breast cancer and hematologic malignancies, and she's also a health services researcher with interests in health technology assessment, global health systems, and large database analyses of cost and quality in cancer care. Now, let me tell you about Dr. Meredith Giuliani. She's the medical director of education and a radiation oncologist at the Princess Margaret Cancer Center. She's also chair, this is going to be a long list, chair of the Canadian Association of Radiation Oncology's Education Committee, medical director of education here, director of undergraduate medical education for the Department of Radiation Oncology at the University of Toronto, and the Cancer Care Ontario Smoking Cessation Champion for Toronto Central South. Meredith's research interests include the influence of globalization on education, with a focus on curriculum design and implementation, and her clinical interests are in lung and head and neck cancers. So let's get started and learn more about this great program. It's the first time that I know many of you as viewers are hearing about this program. So Danielle, I want to ask you, what's the vision behind the Princess Margaret Global Cancer Program?
So thanks so much, Miyo, for the introduction. It's really wonderful to be here with everyone today. The vision of the program, in brief, is to have a meaningful impact on one of the leading global health challenges of our time. There's nearly 20 million people worldwide who were diagnosed with cancer last year alone. And controlling a disease like that is beyond the capacity of any one institution or one country to address. Innovation in both discovery and delivery of effective cancer care requires global exchange of knowledge and information. And we have as much to learn from our global partners as they do from us. And we've all seen how important this kind of global interactivity is for advancing science and medical care over the last 18 months. The Global Cancer Program was originally launched to consolidate, synergize, and build our activities in global cancer control, and also to integrate a health equity lens to our work at Princess Margaret to address growing disparities in cancer treatment here locally, as well as internationally. And achieving this kind of goal requires global partnerships to deliver comprehensive cancer services around the world, to conduct research with meaningful impact, to train the next generation of cancer leaders, and really to mobilize the international community to engage in collective action to advance cancer control worldwide. It's really for this global community to say cancer on a global stage is important. And this is what our Global Cancer Program aims to do. And we're very fortunate not to be starting from scratch in this endeavor. We have a great history of great success in productive international collaborations under the leadership first of Dr. Mary Gospodarowicz and now with Dr. Keith Stewart. We've established and continue to establish successful partnerships with institutions around the world in the Middle East and East Africa and India, China, Germany, France, Brazil, to name a few. And we've learned a tremendous amount through all of them. I might say that launching the Global Cancer Program last year, as we did just before the WHO declared COVID-19 a global pandemic, was not without its challenges. But the pandemic also proved to be a painful reminder that the health of individuals and the strength of health systems in all parts of the world are really inextricably linked. And kind of this idea that we're all in this together, I think really resonated throughout the pandemic. And as an internationally recognized leading center of excellence, working with our global community to improve cancer care for patients and their families, regardless of where they live, is an essential part of our global responsibility.
Danielle, thank you so much. I mean, it's amazing to think of the breadth of this program and that officially it's only just over a year old. And I love your framing that as really members of the human community, we have a responsibility for the world to really manage cancer. And it's a shared responsibility. I think of what you and Meredith are doing as bringing Princess Margaret to the world and bringing the world to Princess Margaret. It really is extraordinary. I want to pick up on your comment just around the importance of kind of education and shared learning. And Meredith, I'm wondering if you could talk maybe specifically about the education and training component of the program and what are the main objectives you're really hoping to achieve?
Absolutely. Thank you so much, Miyo. You know, education is really the factor that underpins the delivery of cancer care. It's how we upskill existing providers to provide new types of treatment or and deploy new technologies in the clinic. We train the next generation to really practice in the way that we, I think we'd like to change the health system and to practice in different ways. And really the way we train is the way we'll ultimately practice. So we have a great opportunity across our training programs to really change not only the day-to-day interactions in our own clinics, but across Canada and internationally. We've had a strong history of international fellows and other trainees coming through Princess Margaret. At some points, our program for our fellowship program is 75% of people that come from outside of Canada, which is really wonderful. The education part of the global program, we're really hoping to advance in a few areas. One is really enhancing our digital technologies to be able to take all of the fantastic programs that we have and share them across Canada and share them with our global partners and even beyond. And then also to have a way that our global partners can share back with us. I think we've all learned from the pandemic the power of technology. We were very fortunate that Princess Margaret invested almost 7 years ago in in a strong learning management system for education. And we've been able to pivot and use that throughout the pandemic to support a number of our partnerships. It's part of, we're going to speak about the GOLD program, and it was part of how we were able to pivot that online and continue. We're very keen to focus on leadership development. We'll speak about the GOLD program today, which is for fellows. We have a strong young leaders program at Princess Margaret. And we really want to enable people with the skills and the passion to engage with leadership both locally and to change the health system. Cancer care, although it touches so many Canadians and people across Toronto, having a seat at the tables that make decisions around resource allocation, the way hospitals are run, the way the system is run. It's so important that we have people that are versed in cancer in those various positions. So we're very keen on promoting leadership training across all different levels and really to enhance what we call the factors of inclusive leadership. So to really make sure that our future leaders are coming from across the cancer system and are able to represent our patients and their families in the most representative way.
Yeah, thank you so much. And I mean, I think at the heart of Princess Margaret is inclusive leadership and patient-centered, family-centered, inclusive care, which is, I think, part of our secret sauce and part of our magic. A couple of people have said to me, in the world of healthcare and the pandemic, how has the pandemic really impacted things, and particularly things like education and training, if it's not necessarily directly pandemic related? But it sounds like that is going extremely well and that the pandemic hasn't slowed things down.
I think we were fortunate at Princess Margaret that we had some of the infrastructure that we had in place that allowed us to pivot very quickly. I don't know that the experience in all areas has been the same. So our cancer campus, which some people here may have experienced, it's where we host all of our online patient education classes. So we were able to take every class that was going on in person, and within a couple of weeks, we had a version up online to be able to carry on. And then since then, the suite of classes has continued. And it's also been a great opportunity for the clinical training programs to really sit back and say, what can we leverage in terms of the flipped classroom concept, and what can we put online and share across programs, and even bring in international experts and have them speak to people, and then be able to do different things when we get back in person. So it's been a great opportunity to, I think, reframe some of the way we've always done things. And I think we'll always keep a degree of our virtual engagement, because even the reduction of travel, we've talked about the millions of kilometers that have been saved through virtual education and virtual care. So we need to grow our infrastructure. It's part of our global strategic plan to build that digital education infrastructure, but we were very lucky to have it when we did.
That's great. That's great. And it's nice that through COVID, we've been able to reduce the friction of global travel in some cases. You mentioned international experts, Meredith, and I'm wondering if you or Danielle can talk about the Global Cancer Network and how we interact specifically with those international experts. I think that'd be really important for us to understand.
Yeah, so Miyo, thanks for that question. And I think one of the things you're referring to is this new Canadian Global Cancer Network. And this is a network that emerged really as an initiative of our Global Cancer Program in partnership with the Canadian Partnership Against Cancer, or CPAC as it's otherwise known, which is a federally funded pan-Canadian agency that addresses cancer on a national level. And we began by first working to understand what the scope of global cancer work being done by Canadians and Canadian institutions was, and by others in the world. And this was really when we were starting our own global cancer program. We were wanting to learn what others were doing. And we found many global programs based in major US cancer centers and in some other countries, but no formal programs in Canada, even though we knew there were many people in Canada engaged in global oncology work at the university level or within governments or other NGOs. So along with CPAC, we decided to host a global oncology workshop last November that brought together Canadian leaders in global health and cancer control. And we had a number of goals for the workshop. First, to identify priorities for Canadian initiatives in the field of global cancer control, to create opportunities for collaboration between different Canadian investigators working in the same field, and to find ways to work together to embed cancer within Canada's broader global health agenda, really to make it a global health priority. And there was a recognition that Canada has substantial depth of expertise in this area and in generally in strengthening health systems, and that we have a unique opportunity to collaborate and to contribute on the world stage. And so from this shared understanding and connection came the idea of the network, which is really a structure to connect individual global cancer initiatives led by Canadians, and to develop a coordinated and systematic approach to stakeholder engagement, and to highlight the need for unique funding support for this programmatic area. And until now, global cancer, at least at the federal level, our federal level, has often fallen under other priorities, such as non-communicable diseases or tobacco control. But these have either been too broad or too narrow to support the development of a comprehensive strategy and advocacy for global cancer control. And we felt that a dedicated network could actually support cancer control becoming its own priority in Canada. It could promote academic career pathways and mentorship within the field of global cancer, and it could create opportunities to contribute to global projects in cancer control in a more coordinated way and in a more impactful way. And it'll also allow us to draw attention to the need for what's become known as decolonized approaches to our relationships with institutions in other countries. We want to promote partnerships within Canada that accept the leadership of those who have lived experiences of disparities. This was largely a Canadian workshop, but we invited a number of international speakers to inform our discussions and who will also ultimately be involved in this network. And one of these speakers was a radiation oncologist from Ghana who made the powerful comment that you have to understand me before you can help me. And that comment became a focal point of the workshop discussions on how a network could support these kinds of effective partnerships. And I think this reorientation applies not only to the interactions of Canadian organizations and partner groups with others in low and middle income countries or in other countries around the world, but I think it can also encourage reflexive work to think about systems in our own organizations that may unintentionally reinforce systems of inequality. And so our global program in this network is really thinking about disparities in general, regardless of geographic location.
I find that just amazing in terms of being able to reduce the disparities, and you have to understand me before you can help me. That sounds quite, if I can say so, uniquely Canadian in terms of its framing. And I love that. You did mention that there are some US-based global cancer networks. I've got two other questions for you, but maybe before we go there, you could just comment a little bit about what really distinguishes the work in Canada versus some of these other global networks that are out there.
Yeah, so I think at least our Princess Margaret Global Program is unique in a number of ways. It's the first of its kind program in Canada, and it set an example for other institutions across the country that are now establishing their own global cancer programs at McGill, in Ottawa, at Queen's. And I also think our global program is beginning to act as a unifying force within Canada. In 2018, a few years ago, The Lancet, which is a major medical journal, published a series on Canada and looking at global health in the Canadian context. And it found an exceptional degree of fragmentation across global health programs in the country, and really a lack of what they called harmonization across the policy, practitioner, and research community. And we saw our global program as an opportunity to bring together Canadian organizations to advance global cancer control in a more cohesive way and hopefully in a more impactful way. The Canadian workshop that we organized last November and the Canadian network were important steps in the coordination of Canadian efforts in this field. I think our global program is also unique in that it's integrated into all aspects of the Cancer Center. It involves the exchange of physician scientists and clinical fellows with other leading international institutions, sharing of clinical expertise through virtual tumor boards with our international partners, seed grants to support novel global research initiatives, collaboration on research and advocacy with international organizations, Union for International Cancer Control, the World Health Organization, the International Atomic Energy Agency, as well as educational programming that Meredith talked about already on leadership development, on health systems, and global cancer control. And we're really fortunate to be well integrated with such a well-developed cancer education program. And our program's also guided by real leaders in the field, and as well as leaders from each of our clinical departments and programs. This isn't a standalone program in the hospital. People are engaged and committed to this idea of global cancer control. And it was strongly supported by Dr. Mary Gaspareres, who is a real champion in the field of global cancer control, and now by Dr. Keith Stewart and the executive committee of our cancer program. Finally, our program differs from some others in that our aim is not to build satellites or mirror images of Princess Margaret in other countries, but really rather to work collaboratively to ensure that high quality cancer care in all parts of the world is delivered in a way that's affordable, feasible, accessible, and culturally sensitive and acceptable.
Thank you. And I love the idea that's just, not the arrogant view that what we're doing necessarily here, you just kind of go export to the world, that there really is a lens around cultural diversity and equity. And I can't wait to hear shortly from our three fellows that I know are also on our webinar. I mentioned that I have two other questions for you. One of them is, I know you are both radiation oncologists and seeing patients. So I'm really interested in understanding why it was so important for each of you to take on this additional portfolio. And I'm also wondering if you could comment on success of the global cancer program, kind of 2-3 years out. We're going to talk about the future even further later on, but what does success feel like to both of you in the next couple of years? I'll start with you, Meredith.
Sure. So, maybe just touching back to my clinical practice, it's the lived experience of my patients and their family and their caregivers that, one, it's very motivating, to want to make things better and to really continue to support the things that people that people tell me are, the things that make care at Princess Margaret so exceptional. The people, the dedication to the experience of everyone. We have a long history of trying to move towards being a health literate organization, and that dedication has really led us to be a Canadian leader in the resources that we have available. So I mentioned the classes; they were in person, and we've been moving them online because Princess Margaret services such a large geographic area that continued transport to the hospital can be quite challenging. Our collection of other resources like e-learning, videos, pamphlets, that it's all supported by philanthropy, and it's all because we're dedicated to changing things and making them accessible and really being that kind of health literate organization. And my patients' experience show me the gaps in the system. In head and neck, we have a very large catchment area. In my lung SBRT practice, we were even seeing patients out of province at one point, and you really, through their stories, begin to understand the challenges, not just in receiving treatment and the side effects, but in all of the other things that go into receiving care and the impacts on families and sort of that very broad areas. And I think that's why Danielle and I are so dedicated to, leadership training and really doing it at a systems level, because the system, the system is the way it is, but there's a lot of things that could be better. And we want to have people positioned all over the place to make those changes and to really bring a united voice to that. So it's very motivating. It's also very, it brings perspectives that you don't see. As a radiation oncologist, I see one aspect of things, and I have to hear from other people to understand, the full story. And everybody brings a different perspective.
Mm-hmm, mm-hmm. So Danielle, I want to hear about how this has impacted your work with patients, success in 2-3 years, and then we'll talk about the GOLD program.
Yeah, so I think at least for taking on this portfolio, I don't think for either Meredith or I, the reason was because we didn't have enough to do. I think there's definitely no shortage of patients to be seen here, but I think the opportunity was compelling for me at a personal level because the themes of health equity and health policy and global health have really been part of my own academic interests and personal interests since I was an undergraduate student, and that have really informed my training in medicine and in radiation oncology and in the way I try to think about my practice. They've been central to my clinical and academic work, both at the Cancer Center and now at the university. And I think, it's very unique at Princess Margaret, where we have an environment that global health can become embedded in all of our thinking. Our Meredith talked about this, our patients, our staff, our colleagues, and our collaborators come from all over the world. And it's really inescapable for us to recognize that global and local cancer control are inseparable. And so I think for these reasons, and because Princess Margaret and Dr. Stewart were really prepared to make global cancer a priority, that this is a really unique opportunity to make a difference in a field that matters, I think, so much to both of us. And so where can we go in a few years? I think for a long time, we talk about innovation and innovation in all aspects of medicine. And I hope that this global program can allow all investigators and scientists and clinicians around the cancer program to think about how we can make innovation accessible for everyone. And so the more we can start talking about that, the closer we'll get to actually achieving that goal.
Yeah, it's almost like a democratization of innovation, right? If we can make it more accessible, more tangible for people.
And I think if you don't think about equity and you don't think about disparities at the outset, it's very hard to backtrack later.
Yeah, you can't build it in at the back end. Can you talk a little bit about the Global Oncology Leadership Program and how that program works? And then I know we're waiting to hear from our fellows.
So I can start, and Meredith, please feel free to jump in, because this is a program that we've really co-developed together, along with some other very important people at Princess Margaret. So Global Oncology Leadership Development Program, it's been referenced already this afternoon. We call it GOLD, and it's one of the first initiatives launched by the Global Cancer Program together with Cancer Education, starting in 2019, so just before our program officially launched. And Meredith mentioned that every year, Princess Margaret hosts about 200 fellows from across the Cancer Center, about 75% of whom are from outside of Canada. And I think these have been exceptional experiences for many of them. They can comment, you'll hear from a few in a moment. But they were largely focused on clinical training. And we had one fellow, a surgical fellow who had come from South America, and he had said to us a couple of years ago at the time, I came to Princess Margaret to learn to be an excellent surgical oncologist, but I also came to learn how to build a leading cancer center. That's what I'm expected to do when I go back. That's what I came here to learn about. But I haven't learned about that yet. I'm really just stuck in the OR, stuck in the clinic. And so we developed GOLD to fill that gap. And the GOLD program runs over 8 months, and it's designed to equip fellows in the cancer program at Princess Margaret with the skills, networks, and opportunities to develop as leaders in cancer care at a local level, a regional level, and an international level. And so the idea is that the program complements clinical training, and it's really one of the only forums for fellows from across the cancer program to meet and interact with each other. You could have two fellows in different departments from the same institution in another country who didn't even know they were both working alongside each other. And so having that interaction and getting to meet people from all over the world, that's a very powerful network of future leaders in cancer care that you're developing. And Meredith, and we'll talk about as well, this GOLD program is offered completely free of charge, and it mixes core training on leadership with training on cancer policy and health systems, on economics and financing of cancer care, and on research and innovation. And it's taught by a mix of local and international faculty from oncology, from global health, from the business community, and participants also benefit from structured mentorship opportunities with senior mentors within the Toronto academic health system. Sometimes it's hard for your direct supervisor to be your mentor. It's great when it works out, but sometimes it's nice to have mentorship in different areas. And so this program actually allows participants to meet people outside of their home base. So this year was the second year that we ran the course, online, of course, this time. And there were 34 oncology fellows from 22 different countries participating. One of the highlights of this course for me was the graduation event from the course in May of this year. We invited some of the fellows from prior years to participate as well. And I think seeing the community and that network that's developing tied to their time and training at Princess Margaret was a very special moment. And actually, if I can, on one of the subsequent course evaluations, one of the program participants had written into us and to say, you know, thank you for giving access to this knowledge to people who never even imagined they could be trained as leaders. And so what we're really hoping to do is get a lot of people and a lot of these fellows who come from all over the world to recognize that they are leaders and to really equip them with some of the skills that they need to become that in their own institutions or here if they stay here.
This is building the world's future cancer leaders, and it's leadership at scale.
Exactly. And, you know, I think I've been so impressed by the exceptional skill and compassion of all of the trainees who've participated and really their determination to improve the cancer system as a whole.
Maybe I'll just add to that, Danielle, you know, there's such a rich discussion that goes on amongst the group, bringing their own context, their own experiences. It's a very hands-on, practical program. And, you know, we learn a lot from everybody that attends. As Danielle said, over the 2 years, we've had people from 32 different countries be participants, which is fantastic. And I think it gives you a flavor of how diverse our fellowship training program is. And right now it's only offered to our internal fellows, and we had a few of our partner organizations join us as a bit of a test run because we had to flip virtual due to the pandemic. So we thought we would test the waters there. I think I get at least an email a week of people who are not part of our fellowship program who want to join. And we're just we've been debating how we can make something happen in that way. But very unique program because most leadership development programs require sponsorship for applications. They can be very expensive. And when you look at the leadership development literature, those are actually barriers to having inclusive leadership and are some of the things that lead to a lack of diversity at the highest levels of leadership. And we're very keen to have an inclusive process. It is a competitive application and we have fantastic applicants, but there's a real breadth of people that review those applications. But all of the executive has supported the program and freed the fellows up to attend. We know how busy they are getting time from clinic and from the ORs. And it's really kudos to them to dedicate their time when they're already so busy with their research and clinical commitments to, you know, advance their skills in this way. And all 67 of them from across the 2 years have been such a pleasure.
Incredible. Totally incredible. I know I keep threatening to introduce our fellows. So Danielle, I'm going to turn it over to you and let our audience meet some of our fellows and hear a little bit more about the program.
Great. So we are very lucky to have 3 fellows here participating. And it's my pleasure to introduce Dr. Abba Scott, Dr. Gilla Shapiro, and Dr. Richard Spence, who are all participants in our program. Abba was one of our participants this year, and Gilla and Richard participated in the first year of our program. I'd now like to just open it up to them, and if we can, each introduce themselves and tell us a little bit about their background.
Hello, thanks a lot for having me. I'm Abba Scott, an early career oncologist from Ghana, which is a low middle income country in West Africa. And I'm currently pursuing a clinical fellowship at Princess Margaret to attain competencies in modern radiotherapy techniques for the management of gynecological cancers. I'm actively involved in the management of cancer from across the West African belt. And I say that because we have patients coming from other countries to access treatment in Ghana. And I must say that I have witnessed the severity of the burden of cervical cancer amongst our population. It actually accounts for about 80% of our gynae load. And so one of my clinical goals is to help reduce and ultimately eliminate the racial and economic disparities in the outcomes of patients with cervical cancer especially. And I hope to do that through advocacy and also the use of the advanced techniques that I learned from Princess Margaret back home.
Thanks so much, Abba. Gilla?
Yeah, thank you very much, everyone. It's very nice to be with you. It's also nice to see my fellows from the training. I am a postdoctoral student and also a psychologist at Princess Margaret in the Department of Supportive Care. And I've been at the Department of Supportive Care for now 2 years. Before that, I have a master's in public policy and public administration and a background in psychology. So for me, my interest actually developed during my PhD in cancer prevention. That's how I started getting interested in cancer control. And I was interested in vaccination and vaccine hesitancy and behavioral science and ways we can improve cancer prevention activities. And then as I became more involved in my clinical work as a psychologist, I want to support individuals in their clinical while they're going through cancer treatments in supporting them so that they are able to manage from a psychological, emotional, spiritual aspect as well, that we're making sure that we're supporting our patients as best as possible. So I was very pleased to join, and I look forward to talking to you guys a little bit about the GOLD experience and how it's changed the work I do.
Wonderful. Thank you so much, Gilla. Great to have you both here. Richard, can I ask you to introduce yourself?
Of course. Thank you very much for having me. I'm a huge proponent of this course. Great to see my fellows. And as you can see in real time, we're linking each other together. Abba, a co-African, and now in this panel, we together in real time. And you can see how this course does link us together in that way, despite us tuning in from Canada. So my journey to Princess Margaret went via, obviously, South Africa, is where I trained as a general and MIS surgeon, then to the UK and the US, and finally to Canada. I was very pleased to come to Nova Scotia to do minimally invasive surgery. And in many respects, I felt my surgical oncology training at the Princess Margaret Centre and Toronto was almost my finishing school in many respects. And then it's actually day one of my clinical practice as a staff surgeon at Dalhousie University here in Nova Scotia. Really, the bigger picture is to try and leverage what I've learned from my training, specifically out of the Princess Cancer Centre, Princess Margaret Centre, to people here in Nova Scotia. And of course, the bigger vision is my interest in sub-Saharan Africa as well. So leveraging those training to do that. So thanks very much for the opportunity, and only the best to speak about the GOLD program.
Well, thank you so much for joining us on your very first day of clinical practice as a staff. So really appreciate having you here. I think maybe picking up a little bit on our discussions with the GOLD program, you've talked a little bit about it, but I wonder, can you tell us why you picked Princess Margaret and why you chose to participate in the GOLD program, maybe as it relates to some of your career goals or aspirations? Abba, why don't we go back to you?
Okay. So first of all, Princess Margaret for me was because of the health professionals. Going back to 2014, 2015, I was introduced to Dr. Rebecca Wong and her team, and they took us through lectures on cancer research. And I must say that I was amazed at their dedication to us to help us navigate the world of cancer research. And down the line, I was also introduced to Dr. Milosevic. I spoke to him about my career plans, and surprisingly, he organized his team to meet me, to navigate, go through how to become like a good guiding radiation oncologist. And I would say that I have achieved one of the greatest feats in my life, winning the Conquer Cancer Foundation, working with Dr. Rodin and Dr. Milosevic, because I came to PMH. It's something that I never would have dreamed of if I'd stayed back in Ghana. For me, the GOLD program, I would say that my background was such that we never had any leadership training. Our focus was more on clinical work. And for me, the GOLD program is the first ever leadership training I have had in my career. And when I looked at the objectives, there was one bit that mentioned training in economics of cancer care. That goal actually came in handy because at that time I was working on my proposal for my research and I needed a bit of economics in cancer care. And also the opportunity to have mentorship. I mean, I felt that I needed to be on. And I'm so grateful I joined. I've learned so much, and I'm just hoping that eventually to be extended to our folks back home. You don't need to be a PMH to access the program.
Yeah, absolutely. And Gilla, maybe I'll go back to you.
That's great. So some similarities actually with Ava. I also came to Princess Margaret because of the mentors who would supervise me and work with me. I've had great mentorship on both the research level from Dr. Madeline Lee and Dr. Gary Rodin, and also clinically, Dr. Andrew Mathew and Dr. Renat Nissim. Like for me, I needed to, at that point, be licensed in the place I wanted to work. And they allowed me not only to do my research work, but also to get clinically licensed and connect me with not only national leaders in cancer control and supportive care, but also internationally to get involved in the work that they were doing. And so for me, that was very exciting to see this international community that they had built and to be part of that. I came to the Gold program also kind of similarly in that there was academic points at the program that really piqued my interest, particularly around cancer control and prevention, and also how we can leverage what we have learned and make it culturally sensitive and adaptable to other places and feasible. And so that really, for me, was really interesting and also aligns with my goals of wanting to make sure that we're not only just benefiting the people around us, but like Danielle had said earlier, the human, their fellow humans. So that was an important aspect. And then the other point for me was really to meet other people. As we had discussed earlier, we often find that as fellows, you kind of get into what you're doing, and that's the focus of your work. And I wanted to meet other individuals, other fellows from other places in the world who have had different experiences and to talk through our career goals, to work it out together. And I think that's been one of the most interesting and helpful parts of the program, is to facilitate this networking.
And Richard, I can turn it over to you.
A couple of comments to add. I mean, really, it wasn't about whether or not I chose the Gold program. It was very much about whether or not the Gold program would have me on the program. I think, to be honest, I have been fortunate to train in a number of different places. There's no place that can host a program such as this. Well, it's very difficult to host a program such as this, let me say that, because what happens is we can be trained abroad, but we can be recognized locally for a fellowship opportunity. And there are not many places that will take you on being trained abroad and accredit you as a fellow. So the diversity that you have in one house, in one room, in one program or one call or whatever so be is really actually quite remarkable, and what really drew me to the program. Not only from where people are coming from, but also the degree of different specialties within. We see here psychology, radiation, oncology, myself coming from surgery. We work a lot together. We like to think we understand each other well, but the reality when the service delivery happens, we don't actually enable us to do a course together, sit down together, brainstorm together, and really get to know each other's disciplines like I kind of felt through the Gold program. So that's what I really enjoyed and what I wanted to achieve from the program. So again, thanks again for having me on the program.
So can I also add that for me, I'm coming from a resource constrained environment, and I mean, our focus was on clinical skills, but I feel that in such settings, you need more than clinical skills to make a significant impact in the lives of your patients. And so being a great leader really would help you achieve your goals, your clinical goals, your career goals. And for me, the Gold program was it for me. And I'm so grateful I joined.
I have to say, it's very heartwarming for me to hear all of this. And I will say for anyone listening, I promise I didn't prompt anyone to say these things. Miyo, I wonder, do you have any questions that you'd like to ask of our fellows? I could keep going.
I've got a question about the future, but since you're all so familiar with the GOLD program, I'm wondering what advice you would have to continually enhance the program and enhance future fellows' participation experience in the program. What advice would you have?
So for me, I think there's something I should have mentioned earlier. There was this bit about the program, the discovery or the insight. I don't know if any of us remember, where we were made to answer questions, and based on that, you are told your strengths and your weaknesses. And one thing that came up was wisdom accepts that we all have two parts, our strengths and our weaknesses, and that our weaknesses are overused strength. I felt that resonated so well with me. I felt that having a weakness per se doesn't make you less of an individual. It's knowing how to overcome that weakness and using it to improve your care and the society that you live in. And I think that I'm just hoping and praying that it will be extended to all people. I mean, other countries, West Africa especially, and that will be adopted onto the program.
Thank you, Ava. Gilla or Richard, other thoughts in terms of how we can continue to evolve the GOLD program?
Yeah, maybe just to add to that as well, I think the curriculum is great in that it draws on what we can learn in terms of our disciplines and from each other, and then also leadership. So I really do enjoy that. I think maybe the continuation of meeting. So I was very happy to participate in the alumni. I was, the graduation of students this year, and it was nice as an alumni to come back and to do that. And future learning opportunities and opportunities for us to get together and share how things have been going and what we've learned along the way as we continue in our careers. I think that would facilitate more discussion and also learn from each other as we become leaders, hopefully in different roles.
Thank you. And Richard?
I think it was Danielle who made the comment about how you make innovation accessible. And I think this is exactly a kind of a program that could do that, to Abba's point, to reach out West Africa, wherever your interest may be. So for sure, to consider how best to do that. I do specifically with this course in mind, my richest memories. I fortunately was one of the first years that did it, so it wasn't in the pandemic time. Getting together and the sort of tangible nature of that, maybe we're a little bit more hands-on in surgery or anyone in the room together, but to be able to come together as a very multidisciplinary team of providers under one roof and really get to know each other from that point of view is very novel. So this is the right program to expand. The diversity is sitting on University Avenue and getting everybody in under one roof at the Princess Margaret mustn't be underestimated. So it's basically a vote in both directions. How you do it, well, I leave it to Meredith and Danielle to deliver on that.
And I absolutely know that they will. I totally appreciate your advice, and so great to talk to people that have participated virtually and in person through this program. We're going to go shortly to Q&A from our audience, but I've got one question for everyone. And that question is, think forward 25, 30 years from now. This program's been running for a couple of decades. We think about the world in 2050. Things like artificial intelligence, virtual reality are ubiquitous. The global market's grown 50%, the world's population at least by 25%. What do you see as the future of global cancer control? What's different in 2050? I'll start with anyone who puts up their hand and wants to take that one first.
So,
all right, Ava.
Just hoping
I love that.
In 2050, patient outcomes will be the same, irrespective of where the patient is. If the patient is in West Africa or in a small village back home, his treatment outcomes should be the same as someone treated in Princess Margaret. And I hope that I'll be able to translate the knowledge gained here back home into my practice, not only into my practice, but also to help train the residents back home so that at the end of the day, would be able to give the best outcomes for our patients. And for me, it's really important because first of all, as I mentioned, we treat patients from across the West African belt. And also we also have residents coming in from other West African and Eastern African countries. So I'm just hoping that if we're able to do that back home, the impact to be far-reaching, not just limited to the shores of Ghana, but to West Africa and also to East Africa.
Thank you. So cancer outcomes are geography neutral in 2015,
Yes.
whether you're diagnosed in Toronto or London or fill in the blank, your outcomes are going to be consistent across the world.
Yes.
That's inspiring. Anyone else? Gilla?
Yeah, I'll go first. So I think a few things. I would love to see more equity and access, and not only between regions or countries, but also within countries. There's a lot of inequities. If you think about rural or urban, or if you think about within racial inequities, and I think that's those kind of inequities I'd like to see us try and close and to understand better in order to close them and to put them first. I think also integration of care is another important aspect that I'd like to see, and that has to do with a third aspect as well, is patient-centered care, right? That the patient can be the coordinator, the coach, if you will, of their care, but they have access to many different services, and that it's all really nicely integrated for them, so they have a very seamless experience of the cancer center.
Amazing. Meredith and Danielle, I'm going to be asking you too, but Richard, do you have thoughts?
Yeah, I mean, I think it's on very similar threads in terms of inclusiveness and reaching out to essentially closing the gap that we have in cancer care, albeit in your own city, village, country. And I quote probably, I think Porter's a medical oncologist based in the US who says we're trying to deliver on 21st medicine technologies using outdated 19th century technologies. And so really, if we can harness the technological advances that are coming to us in, like is happening in other service industries, we should do more in healthcare in order to deliver on that and to really close the gap. So I really hope that we can increase accessibility using mobile health technologies, automated intelligence in order to close that gap. And I hope to see that we're going to be a part of that.
Thank you. Danielle.
In 2050, I think I'll say I hope we have many more people like Abba, Gilla, and Richard around the world. I think we'll be in a much better place with cancer professionals like them moving forward to close the gap that I think that was really touched on in our conversations today. We want innovation everywhere, and the only way to do that is by training leaders who will deliver on it.
Thank you. And Meredith.
Yeah, I guess to close, I really think by 2050, we'd love to see the understanding of cancer across the health professions be, really leapfrogging from where it is now to really push forward on, detecting cancer earlier, leveraging all our new technologies to do that, things that people here have probably heard around liquid biopsies and other things, being able to treat people not only to enhance cure, but in ways that have less of a lasting impact. And for those that do have sequelae from their treatment, to really have access to rehabilitation services and that broad spectrum of treatment and support. It's not just about cancer professionals, it's about us, Richard touched on it, but working across disciplines and being able to educate the broader community about cancer and being able to bring, the care and the support to where people are instead of just in very centralized small pockets. So, I would love to see things. I would love the whole system to be very different by 2050. I think we're shoehorning things into a system that was set up for very different priorities in medicine. So hopefully, if we give it 30 years, we'll be in a different setup.
It's inspiring. And the faster we can get there, that's what I know we're all committed to. I know we've got a couple of questions that have come in, and we've got a few minutes for those. I'm not sure where those appear. Let's see if we can pull them up. So we've got a question. Can you please share some of the significant breakthroughs in cancer research that are done through the research programs of the Princess Margaret Cancer Center? And I'll just read them all out. Is there a type of program that's standard at other, is this type of program standard at other cancer centers? And what are some of the global partnerships we're really excited about and why? So Danielle, I'll ask you to triage those three questions. I think everyone can see them.
Sure. So I think there's lots of exciting research being done at Princess Margaret. Maybe we'll take this as a chance for Abba, Gilla, and Richard to talk about if they want to mention any of their work and their research in global cancer control. Would any of you like to comment on some of the research that you've done in this area?
Okay, so just a brief background. Ghana, our total population is 31 million, which is quite close to that of Canada, but we have a total of 5 external beam machines, which is woefully inadequate. And so currently my project is looking at developing a cost utility model for radiation to increase investment in radiotherapy and also to increase access to radiotherapy back home. So I'm just hoping that we'll be able to pull through with that. And I'm currently working on that with Dr. Rodin and Dr. Milosovic, and it's coming along nicely. So I hope that we'll be able to get our stakeholders on board and invest in radiotherapy in Ghana.
Gilla?
Yeah, so I work in the Department of Supportive Care, and I try and understand better what kind of treatments, like psychotherapeutic treatments we can offer, and what works well, what works not only best, but for whom and in what context. So that's some of the research I'm doing, is evaluating different psychotherapeutic techniques. And the other area that's kind of more newly developed since I've participated in GOLD is to work with Danielle and others to try and better understand disparities that exist in our system and to better address it. So for example, COVID allowed us to test out virtual care, and a lot more appointments and things like that would happen through virtual care. So understanding if that was a benefit or a hindrance to different individuals in our center, and to then understand who gets access to different services in the hospital. So that's some newly developed research. So you'll have to stay tuned for the results because we're just in progress right now.
Richard, I don't know if you'd like to speak to some of the work you did when you were a fellow or some of the work you're taking forward.
Sure. I think what we've mentioned in terms of the gap that exists in oncology care globally and even regionally, it's striking to really understand, or rather sobering to understand, how little we really truly know about that gap. So a lot of my work has been in trying to standardize ways of very fluid and prospective data capturing in order to better understand, in my specific interest is surgical outcomes for certain cancers, and standardized data sets. On the thread of standardization, in terms of having come to the Princess Margaret and the question of is type of program a standard at other cancer centers, I think really in cancer care, we've used a mobile health technology application to try and standardize pathways called cancer care pathways that we can take our patient on, very patient-centric, and they rely on patient-centered input to try and, as a standardized way, to try and get that data along their cancer journey, and standardizing what providers put in as well as what patients put in order to just really streamline a process or taking a patient through their pathway of care. So using sort of innovative technological advances or mobile health technology in order to track outcomes and to sort of partner or join that the patient along their cancer care.
So I think, definitely a theme between all of them is sort of learning and different digital solutions that have worked well in one context and applying them to the other. So really trying to build on this concept of what evidence, what knowledge have we learned that we can think about in a more global context and apply in our own environments as well. I'll take the next question, which is this type of program standard at other cancer centers? And I will say it is becoming that way. So pretty much every major cancer center in the United States has a global cancer program because they recognize the importance of it. We were the first ones to do it in Canada, but we are no longer the only ones. Queens has now just come up with their own global cancer program. Ottawa and McGill have been asking about how they can develop their own. So I think that this is becoming part of the standard of care, if you will, of what exists in different cancer centers globally. And I know we're at time, so I don't know if there's time for the last one.
I'll just do a rapid fire. Meredith or Danielle, 3 global partnerships you're excited about. Can one of you take that?
Meredith, would you like to go ahead? I've been chatting a lot.
Maybe I'll summarize it broadly and just say, we do such diverse work with our different partners, and it's been really exciting. We're launching a master course in comprehensive cancer centers through the UICC, really led by the efforts of Mary Gospodaris, but with all of our partners, with Tata, AC Camargo, King Hussein Cancer Center in Jordan, and others. It's been a fantastic opportunity to really talk about some of these global issues, and we're going to keep this course and have it in a way that others can engage with to hopefully, look at how you build a comprehensive cancer center and how to bring all the elements that you're hearing us talk about today to centers that are either emerging or trying to expand their focus.
Thank you. And I know we are at time, so I will wrap up by saying for people who reached out with questions, we're happy to email you additional information, or you can check us out on the web as well. I want to thank our panelists for your time today, and I want to thank our viewers for dialing in. Greatly appreciate your time and your questions. We'll be reaching out to you with a copy of today's webinar if you want to share it in your network, or if you have additional questions, as well as a short feedback survey. And thank you, Team Princess Margaret, for bringing the world here and for bringing Princess Margaret to the world in the incredibly inclusive, equitably focused way that you are, and in a way that I think is uniquely Canadian, and as I said earlier, benefits all of Canada and benefits the world. Really appreciate your time today. Thank you, everyone.
Thanks so much.
Bye for